Thank you so much for joining us once again for another virtual town hall. Whether you're joining us on Facebook or Twitter or YouTube or on our website, I'm really glad that you're here. I want to thank my amazing staff for all the hard work that they've been putting in during this very difficult time, and our whole video conferencing team as well, just doing a great job. We've got a ton of questions to get to today, but before that, I do have some introductory comments, and we've got two amazing guests. And I wanted to begin this week by talking about some of the civil unrest happening in our country right now. The past few weeks have just been heartbreaking and challenging in so many different ways. And last night, I attended a peaceful vigil in Cardiff, and I thought I would share with you the words that I delivered there. The death of George Floyd was tragic, and the loss of another African-American life, especially so given the corrosive role racism has played in our nation's history. The 14th Amendment calls for equal justice under the law. Black lives matter. We must stand for nothing less. We continue to witness an unequal criminal justice system in this country, and I agree with President Obama that we must all raise awareness, organize, and then cast our ballots in support of candidates who will make real reforms. Our democracy is on the ballot this November. Unfortunately, what happened in Minneapolis and similar tragedies that have happened in cities across America damages the trust and confidence in our nation's law enforcement agencies. The offenses committed by the 4 peace officers in Minneapolis were abhorrent and inconsistent with our values. We must use this moment to work with all stakeholders and take the necessary steps to address systemic racial injustice in America and to reform law enforcement. To protest is patriotic, and I believe that the millions of Americans who are peacefully protesting across our nation, including right now, have every right to express their frustration over the unequal economic and criminal justice systems in this country. And I believe that if our democracy is to survive, we must guarantee the right to assemble and to be heard. 40+ million Americans have lost their jobs due to the COVID-19 pandemic. I have spoken with so many people who have lost their jobs, people who can't pay their rent, and also with veterans and seniors who are worried about where they're going to get their next meal. Our nation is in a crisis on many levels. The only way I see us getting through it is if we start listening to one another, start helping each other, start advocating for each other. And then we all need to speak up the loudest for those who need the most help. That's how we're going to bring about real change. So what are our next steps in Congress? Well, this past week, I announced that I'm co-sponsoring the Eric Garner Excessive Use of Force Prevention Act, introduced by my friend, Representative Hakeem Jeffries of New York, to amend civil rights law to prohibit the use of chokeholds by law enforcement across the nation. Second, I'm co-sponsoring the Bipartisan Commission on the Social Status of Black Men and Boys, which was introduced by Representative Frederica Wilson. The bill establishes a bipartisan commission within the U.S. Commission on Civil Rights, tasked with examining the social disparities that disproportionately affect Black men and boys in America. We're also working very closely with our colleagues, both in the Congressional Black Caucus, which is being led by my dear friend Karen Bass, and the House Judiciary Committee, to develop a legislative package, which we are calling the Justice in Policing Act of 2020, which will be formally introduced on Monday. But they have made it clear, both Chair Bass and Chair Nadler of the House Judiciary Committee, that their objective is to create a package with bipartisan approval, not a messaging bill, but something that will have traction, not only in the House, but also in the Senate. And while the discussions are ongoing, again, literally as we speak, some of those proposals being discussed include limiting the transfer of military-grade weapons and equipment to local law enforcement, making it a federal crime for police officers to commit murder or manslaughter, giving the federal government jurisdiction to bring charges against an officer if a state fails to do so, and developing a national standard regarding use of force, training, and recruitment. And the idea of a national standard is one embraced by the Peace Officers Research Association of California, which is the largest association of police officers in the United States, representing over 77,000 here in California. And I strongly support a national standard as well. Although, of course, the details are being worked out as we speak. I've been engaged in dialogue with both our civil rights community and our law enforcement community. And my hope is that in the days, weeks, and months ahead, I can serve, along with many of my colleagues in Congress, as bridge builders in our respective communities. And my great hope is that we use this opportunity to whatever extent possible to create a new normal. And I hope we can do so with compassion rather than with aggression. We're going to be hearing from Reverend Shockley in a minute, but before that, I wanted to turn to COVID-19. Sadly, we passed the 109,000 mark of those who have lost their lives from COVID-19. We're all shaken by that statistic, and we're prayerful for the families affected. It's a heartbreaking tragedy for our nation. Currently, the U.S. has almost 2 million coronavirus cases, over 1.9 million. And as I mentioned, over 109,000 deaths. California has confirmed 126,000 cases and over 4,500 deaths. San Diego County has confirmed 8,180 cases and 294 deaths. And Orange County has confirmed 7,064 cases and 174 deaths. However, I will add that over the last 14 days, Orange County actually had more cases and more deaths, 1,942 cases and 53 deaths, as opposed to San Diego County, which had 1,625 cases and 47 deaths. And that's despite the fact, for those who have watched our town halls in the past, in the last few weeks, that Orange County has been consistently testing less people than San Diego County. And the relatively low rate of testing in Orange County compared to its neighboring counties continues to be a concern of mine that I've addressed and will continue to address in the weeks ahead, particularly among asymptomatic people like those in nursing homes and other higher risk environments. As I mentioned in the past town halls we've done, Congress has passed a number of measures related to COVID-19. I will not go through every detail because we don't have enough time, but what I will say is this. We have done what we believe is necessary for both the public health challenges and the economic challenges that our nation faces. And now is no time for us to take our foot off the gas. We passed back in early March an $8 billion bill for the vaccine that we thought at the time would be sufficient. We soon found it was not. We passed the Families First bill at the middle of March for $200 billion for emergency sick leave, nutrition assistance, and we soon realized that was insufficient. We then passed the CARES Act, $2.2 trillion at the end of March, included over $150 billion for state and local government, $100 billion for hospitals, $31 billion for our education, K through 12 and higher education, and unemployment assistance, an extra $600 a week. The pandemic unemployment account now that has over 620,000 gig economy workers and independent contractors that have signed up for unemployment insurance benefits for the first time. The $1,200 direct cash payment and the Paycheck Protection Program initially had $350 billion. We passed all that. We soon realized that that was not enough. So we went back and we passed another closer to $500 billion bill, another $320 billion for the Paycheck Protection Program, including $60 billion specifically for small and community lenders, another allocation of $75 billion for our hospitals, and another $25 billion to develop a national testing strategy with the requirement that the administration by May 24th present to the Congress an actual national testing strategy. May 24th came and the administration presented to us an 81-page document that was hardly a national testing strategy. It was more punting many of the major decisions and the more difficult decisions to the states. That's not good enough. So we came back and we passed the HEROES Act. The HEROES Act included $875 billion for state and local governments. Of that, cities in our district would receive more than $300 million. And I was honored that all of our mayors, Republicans and Democrats alike, joined in the call for the funding and that we were successful in including it in the House bill. It also includes $25 billion to stabilize the United States Postal Service, $100 billion for low-income renters, hazard pay for our frontline workers, and much more. And I didn't support every word of every page of an 1,800-page bill, but I know that we need to act. And I know that those on the front lines, the small businesses, the unemployed, and so many others, they are required they want us to act, and we are required to act on their behalf if we're actually going to solve the problems that exist. So it's time for Mitch McConnell and the Senate to act. And while I was pleased to see the recent jobs report, make no mistake, it's a good thing that more people are able to go back to work than we thought at this point. But I also think it shows that decisive action by Congress to support small businesses and workers can make a strong difference in our economy. But with over 109,000 Americans tragically dead, 21 million still out of work, and state and local budgets on the verge of collapse, now is the worst possible moment to take our foot off the gas. Now is not the time to declare mission accomplished. It's the time for continued action to support the lives and livelihoods of the American people. Just a couple of last updates. Yesterday was National Gun Violence Awareness Day. In fact, you see behind me, Wear Orange and End Gun Violence. And I was just on a call with a number of our great grassroots activists, volunteers, and gun violence prevention organizations. And I'm very grateful for all their hard work and for everything they do. And we're still, during the Wear Orange weekend, honoring all of those who are working so hard on that fight. I also wanted to let you know that on Thursday, I helped introduce two significant bipartisan veterans bills, both of which I believe have a very good chance of becoming law. First, the Homeless Veteran Coronavirus Response Act, which would expand and strengthen VA services for homeless veterans during the COVID-19 pandemic. Second, the Veterans Economic Recovery Act, which would help put tens of thousands of veterans back to work by creating a rapid retraining program for our veterans. I also announced this past week that U.S. Department of Transportation has awarded the San Diego Association of Governments and the North County Transit District a grant of $11.5 million to stabilize eroding coastal bluffs in Del Mar that jeopardize rail service through the region. And yesterday I had the honor of calling the North County Transit District to let them know that they would be receiving over $94 million in funding through the CARES Act to keep them financially viable through the pandemic. One thing I try to do during all of our town halls is to share the number for the National Domestic Violence Hotline, because I've been saddened to hear stories of increased domestic violence during COVID-19. And I encourage everyone in need to help or call or text the National Domestic Violence Hotline at 1-800-799-SAFE. That number again, 1-800-799-SAFE. With that, I'm pleased to welcome two amazing guests, Reverend Madison Shockley and Dr. Andrea Lacroix. First, Reverend Shockley has been the pastor of the Pilgrim United Church of Christ in Carlsbad since 2004. And along with performing his pastoral duties with Pilgrim, Reverend Shockley is very active in social justice causes in San Diego, serves on the board of directors of the ACLU of San Diego, Compassion and Choices, and the Clergy Advocacy Board of Planned Parenthood Federation of America. A native of Los Angeles, he was educated at Harvard College. I guess that's a pretty good school, Reverend. And the University of Missouri at St. Louis. He holds a Master of Divinity from Union Theological Seminary in New York City and has done advanced graduate work at Claremont Graduate University in New Testament Studies. Reverend Shockley, it's great to see you. Thank you for being here.
Thank you. Glad to be here, Mike.
I'd also like to welcome Dr. Andrea Lacroix, who's back. Did a great job last time she was here. You got a lot of fans out there, and she's going to be answering our questions on COVID-19. Dr. Lacroix is Distinguished Professor and Chief of Epidemiology in the Department of Family Medicine and Public Health at UC San Diego. Go Tritons. She's also the Director of the Women's Health Center for Excellence at UCSD and an expert on long-term observational studies and randomized clinical trials to identify preventative interventions that improve our prospects for health aging. She received her doctoral degree in epidemiology from the University of North Carolina at Chapel Hill. Dr. Lacroix, great to see you again.
Thanks, Mike.
Reverend Shockley, I'd like to begin with you. It's been just an incredibly difficult time for our nation as we watch and participate in the protests and vigils to honor the life of George Floyd, including one that you helped to lead in Carlsbad this past week. I believe there are so many messages to be learned. If you had to pick the top 2 or 3 issues and ideas for people to take away, what would they be?
Well, Mike, let me first of all thank you, Congressmember Levin. I am honored to participate in this important town hall meeting at this tragic, historic moment in our country. I want to say a few words before I speak directly to your question. Every justice-loving person around the world was horrified at what we saw on television Monday, May 25th. Seldom do we see a murder committed from beginning to end on the evening news. George Floyd cried out that he couldn't breathe. Bystanders told the officers that he was dying. An EMT offered to render aid. Even one of the officers tried to take his pulse, but couldn't find one. None of these cries for mercy made George Floyd's Black life matter. To the police officers, to those in Minneapolis, and they continued to press on his back and his neck until he died. I know we have questions, and we will have questions later, but I want to ask and answer this question first. Why do murders of unarmed Black men and women by police officers keep happening over and over and over again in America? My answer is because America has not decided to stop it. You say, when did we decide that? I say, given the reality that from the very first day that enslaved Africans were bought by British settlers in 1619, white supremacy has been the de facto reality of life in America. Why do I say that? Because those English settlers in Virginia bought the enslaved Africans to be the labor to build the Jamestown settlement. This set up a status of white supremacy over Black people from the very beginning. And what we know is that the means and mechanisms that are needed to maintain white supremacy are brutal and violent and deadly. African people did not volunteer for slavery, so white supremacy had to be violently imposed on them. So every time America has failed to undo white supremacy and make equality and equal justice under the law a reality in America, it has decided by default that inequality between Black and white in America will continue, and that the brutal, violent, and deadly mechanisms to uphold white supremacy will also continue. And the police departments of today are the most physically violent mechanism available to sustain the ideology and reality of white supremacy. We have had several key opportunities to decide for equality and against white supremacy, but each time we have declined to choose equality. First, in the 17th century, America decided to continue indentured servitude for whites coming from Europe, but make slaves of all Blacks that arrived from Africa. Then in the 18th century, when the founders wrote the Constitution, they confronted the question of Black equality, but declined equality in favor of a 3/5 compromise on our humanity. Then again, in the 19th century, after a civil war that consumed 600,000 American lives and brought an end to slavery, we had a brief experience with equality during Reconstruction, but this proved incompatible with white supremacy. And so we decided against equality and chose Jim Crow. In the 20th century, Martin Luther King and Rosa Parks and all the heroes and sheroes of the civil rights movement brought back many civil rights taken away by Jim Crow. And again, when our brief march toward equality proved incompatible with white supremacy and cries of reverse discrimination flooded the land, we canceled affirmative action and declined to choose equality over white supremacy. But now, in this 21st century, the deaths of Breonna Taylor and George Floyd, among so many others, have given America another chance to make the right decision. I see a new mood, a new attitude, a new level of breadth and involvement, not just from Black people defending our lives, but from all people of every race and hue. So I'm praying, literally praying, that this time America will say yes to equality and equal justice under the law and no to white supremacy. Overinvesting in policing and punishment and underinvesting in the promise of our communities have given rise to the cry to defund the police. We need to limit the scope, size, and role of the police in our communities and let the people who can actually solve the problems do that. That's the recommendation from Alicia Garza, founder of Black Futures Lab. So the two things I think we need to do, number one, I gave a little bit of the history, but number one, study your history of race in America. This problem has been with us from the beginning. Number two, understand how white supremacy gives birth to white privilege, and while you never made a conscious decision, you are still a beneficiary. And so every day, to find a way to work to disgorge your privilege by investing your privilege in remedies for equal justice under the law and equality in America. So those are my two recommendations: education, know your history, and seek to find new ways every day to disgorge your white privilege and invest it in a better America.
Wow, Reverend, thank you so much for that incredible answer. That was amazing. I have a couple more questions for you. Systemic racism has been on people's minds this week, perhaps as it hasn't been in my lifetime, and certainly not since 1992 with the Rodney King riots. But it does so much damage to so many people and has had such a corrosive effect on our whole society for so long. What do you recommend we do in every day in and day out, our lives to fight systemic racism?
Well, again, we first have to understand what systemic racism is. Those are the systems that have been constructed to reinforce and to keep in place white supremacy and white privilege. The police department is just one of those systems. I challenge my Carlsbad neighbors to think and understand, why is the Black population of Carlsbad less than 2%? And in every community where you have virtually all white communities, ask yourself, why is it that way? Because if you don't ask, and if you don't seek understanding and then do something to change it, if you don't decide, I want to live in a more diverse community and a more diverse America, then those systems will continue. Your communities look the way they do because of our real estate system, which throughout our history has discouraged Black integration into majority white communities. Our banking system has redlined Black communities and depressed property values so that we can't gain the same capital and net worth in order to leverage that to move to more communities of higher standing. Our educational system has denied equal education across this country. That's what we mean by systemic racism. And so when you understand that there are systems throughout our lives that reinforce the separation of the races through segregation in housing, which does still occur. If we had an active housing and health department, they would continue to send out monitors. You can find places today where they'll send a Black monitor to ask about an apartment availability. They'll be told we're all full. They'll send a white monitor right behind them, and they'll say, come on in. It still happens. So we have to work every day. We have to find those systems and find our way into them, and also accept our responsibility for them. if you're an employer, if you're in a position to hire, if you're a real estate company, if you're a government official, be active, proactive in dismantling these systems and bringing about a more diverse community where you live and work, and bringing about a more just America.
Thank you, Reverend. I wanted to turn to a discussion of police tactics that, as I said in my introduction, is something that is being negotiated and discussed right now among my colleagues in Congress. And there are a number of things on the table that I mentioned, everything from the national ban on chokeholds to national standards. And I'm proud that some of our cities in San Diego, including locally in Carlsbad and in Oceanside and in the county of San Diego and the city of San Diego, have stopped the use of the carotid stranglehold as a tactic. But as a member of Congress, and as we continue this negotiation, as we look to introduce legislation on Monday and negotiate it in the coming weeks, what do you think we should be trying to do on a federal level to address this?
Yes. Well, I do understand that the Congressional Black Caucus, Karen Bass, member of Congress from Los Angeles, is putting forward a package of reforms. And I'm so glad to know that you're working with her to enact those reforms. And things like police accountability. I mean, that's kind of the bottom line of what we've been talking about. We have witnessed police brutalize Rodney King. We've seen police murder George Floyd. We understand the police murdered Breonna Taylor. And too often in the past, and even just last week, getting an arrest of a police officer for misdeeds is almost impossible. Then once you get an arrest, to get appropriate charges, then to get a conviction. We haven't convicted officers for these murders that we've witnessed with our own eyes. And so there are many legal prohibitions or protections that police officers have uniquely. And so we need to look at those protections and make them more vulnerable to accountability. Because until there's accountability, there will not be a change in behavior. We also need to demilitarize the police rather than militarize the police. And so on a federal level, we don't need to dump our obsolete or our no longer current military hardware into the inner cities of America. And what the president is doing now in Washington, D.C. is a disgrace. To disband peaceful protesters exercising their rights under our Constitution with an unconstitutional assault by military police and other federal officers is just a shame, and we all ought to stand up to it. And so I hope that Congress will issue some kind of resolution condemning those kinds of actions. So I would think that these reforms on a federal level and also on state level, we need reform. Ultimately, it comes down to the local level. The police unions have a stranglehold on most local politicians. And so that compact has to be broken because the protection of the police union, of the misbehavior of police officers, is the primary force right now that keeps it going.
It's well said, Reverend Shockley, and I'm reminded of the words from this past week. We must, and specifically with regard to using the military in our cities, and I quote, "We must reject any thinking of our cities as a battle space that our uniformed military is called upon to dominate. At home, we should use our military only when requested to do so on very rare occasions by state governors. Militarizing our responses we witness at Washington, D.C. sets up a conflict, a false conflict between the military and civilian society. It erodes the moral ground that ensures a trusted bond between men and women in uniform and the society they are sworn to protect, and of which they themselves are a part. Keeping public order rests with civilian state and local leaders who best understand their communities and are answerable to them." That, of course, was Jim Mattis, Defense Secretary under President Trump, widely regarded Marine General.
And that's why I'm hopeful, because this is a moment where across the board, the violations of civil rights are so blatant that they simply can't be denied, And as I said, justice-loving Americans of every hue and every stripe and every political party are finally saying this is enough. It's got to stop. So I just hope we use this opportunity here in the 21st century to stop it.
Thank you, Reverend. And I'm going to ask you to stick around because as we go through the questions from our viewers, I'm sure there'll be several that will want you to weigh in on. We also have one of our leading medical experts and public health experts in all of San Diego with us, and we have a ton of COVID-19 related questions. And of course, the backdrop of all that we've seen over the last week since the tragic passing of George Floyd has been the pandemic still among us, has not gone away. In fact, the numbers have in San Diego and Orange counties have certainly not gone away. And I have a number of questions. One from Claudia in Oceanside, and she asks, are we overreacting to COVID-19? I actually get this a lot, doctor. She says, yes, the deaths are awful, horrible, terribly sad, but millions of people are out of work. As of last week, 360,000 people have died worldwide from COVID-19. I think it's a lot more now. The population of the world is 7.8 billion. 360,000 isn't even close to being 1%. Even if the death rate doubles, it would be far less than the 50 million who died from the Spanish flu. Yes, again, that's a lot of people, but it's destroying the economy and millions of jobs. The right way to deal with stopping the spread of this disease. So, doctor, we're starting with a very easy question for you this week. Yeah. If you could just give your thoughts, and if you generally want to let our audience know where you think we are, as we progress through this pandemic.
Well, let me start by thanking the Reverend for such amazing comments and say that when I studied epidemiology at the University of North Carolina, we learned that the history you're talking about is very much part of health across the board. And as a public health professional, inequalities in health are ever present in what we learn about and, continually tragic. So COVID-19 is just the current one that we're thinking about, but at every level, we see these problems. So I want to thank Claudia for asking this question that brings to the fore the trade-offs between public health and the economy, or you might say between people's lives and the economy. This is a topic of great debate, and there's no one right answer, but I just want to give you a few thoughts to help put this in perspective. You ask if we have overreacted to the pandemic. Had we not paused with the stay-at-home orders, the death toll would be much higher, and it would disproportionately be killing more people of color than white people. Epidemic modelers predicted anywhere from 60,000 to more than 2 million deaths in the United States from COVID, depending on our behavior as a population. Right now, we're at 109,000 deaths in the United States, as Mike says. The infection is on its way up in this country, I think, because of the increased mobility of the population. It's raging in certain parts of the world, like South America, and it's going to be with us for 18 to 24 months until we get a vaccine and effective treatment. So I'm, without using any fancy models, we're 3 months into this and we're 109,000 people dead. Highly likely we're going to end up with 250,000 or more dead Americans in the 18 to 24 months before we are really able to contain the virus. Had we not gone to stay at home, fear of the virus would have rampaged and still affected the economy. There's an economist at UCLA, Andrew Atkinson, who said, if the epidemic is allowed to grow unhindered, the economy will grind to a halt anyway, as people see an explosion of infections and stop going out. Either you shut off the economy now and have people staying at home, or you let this thing rip and you have people staying at home scared. And the third thing that would happen is that the healthcare systems would have been overrun with victims, as they were in some places in the United States, like New York City and Montgomery, Alabama. To some extent, the experiment of not staying at home and not not being able to attend to people is ongoing in Tijuana right now, and it's causing a heartbreaking humanitarian crisis. So do I think that we overreacted? I think it's hard to know exactly what we could do in terms of keeping the economy open versus trying to save lives. But I don't think we overreacted. I think it's important, as Andrew Cuomo has said, any life we can save is a life we should try to save during this pandemic. And everyone's entitled to their own opinion, but those are a few thoughts.
Well, I would just add to that, and it's very well said, Doctor, that we all want the same thing ultimately. We all want to reopen the economy. We all want to get our country back on track, but we have to do so safely with health precautions in place. Otherwise, it's going to further exacerbate the crisis. It's going to lead to more jobs lost and more businesses that have to close and more economic devastation. And we've come so far. We've made so much progress with the measures that we put in place. Recently, I heard that had we done nothing just in San Diego County, we would have lost 12,000 lives to this virus. But reopening, in my mind, too soon will put us at risk for a second wave of infection and death that would be far worse than it needs to be. So I think we need to do all we can to prevent that, to prevent more lost life and more economic pain. And I think we all agree, though, on the need to reopen. Here's another question for you, Doctor, from Mark in Oceanside. When will N95 masks be readily available to the general public? They should be available for air travel, mass transit, and areas where close proximity is unavoidable, such as theme parks, sporting events, movie theaters, and stores at Christmas time. N95 is not a complex device and does not require scarce raw materials. Fixing this needs to be front and center. Well, my understanding, at least from what I have read and heard, is that N95 masks are not necessary for everyday people, but we still need to focus on healthcare workers and those at the front lines of the crisis. But we have done everything in Congress that we know to do, I think, to provide funding and to push the administration on PPE. We've been doing that since the beginning of March, and we'll continue to do it. And I can tell you that I don't have an N95 mask, and I've been asked, why don't you have an N95 mask? People have offered them to me. I want to make sure that every healthcare worker, every frontline professional has an N95 mask before I or the other members of Congress have an N95 mask. That's my own personal opinion. Some might disagree with that. Some of my colleagues might disagree with that. But Doctor, anything to add on N95s?
Well, let me say a couple things, because I think you can help us out. As you are trying to. The party line is certainly that N95 masks are not needed for the general public because they're needed more by healthcare professionals. And I understand this rationale and support it. But I tend to agree with Mark, our constituent, that in crowded and especially in closed spaces, so level 3, level 4 reopening, including inside airplanes for long haul flights, wearing an N95 mask probably makes sense if they were more widely available. We shouldn't have to be making this choice between sitting on an airplane for 10 hours with you have to assume that the airplane has COVID infected people that don't even know they're infected yet. So I just wanted to remind the listeners that N95 designation means that when subjected to careful testing, the respirator blocks at least 95% of very small 0.3 micron test particles. That's why they call them N95s. And they do filter more viral particles than surgical masks or other kinds of face masks. And we need more N95 masks so they can be worn in high-risk situations as the economy reopens broadly and as the community spread of COVID likely increases over the coming months. So as an occupational health professional as well, there are a lot of workers out there in these crowded places who are not healthcare workers, and they're going to need these N95 masks. In my humble opinion, I want one on you when you start flying back and forth. And I don't think it's fair many months into the pandemic that we're still having to choose between who gets to wear an N95 mask. But I do support what you said at the beginning.
All right. Fair enough. Thank you, Doctor. Here's one from Pat in Oceanside. And Reverend, I want you to weigh in on this in a second. I send an email message out quite regularly to our constituents and to our supporters. And this past week, he actually quotes, Pat in Oceanside quotes my message. He says, in your email message this past week, you said, at the same time, when a small minority of people take advantage of the situation to commit violent acts, they need to realize that their actions undermine the message of peaceful protesters, and they're also putting other people's lives at risk. And then he goes on to say, Mike, it's becoming increasingly clear that a significant amount of the recent violence across our nation is being instigated and carried out by white supremacists. These people don't just, as you said, realize that their actions undermine the message of peaceful protesters. They want to undermine this message, force military countermeasures, and foment unrest across our country. Is there any way Congress can demand that the FBI find and punish these agent provocateurs? Thanks for all you do. Well, I believe that law enforcement should prosecute anybody who is committing violent and criminal acts, no matter the politics of it. And in fact, I think it was announced that in Nevada, there were people that were just arrested and I think will be prosecuted for carrying out a conspiracy of that nature. And I hope others that are similarly trying to take advantage of the situation will be caught and will be prosecuted. The overwhelming number of people that I have seen, interacted with, I've got a whole staff in DC and I get updates from them on what's happening in DC. I've got tons of friends in Los Angeles. I'm hearing all the time what's happening in LA, as I'm sure you are, Reverend. The overwhelming number of people are peaceful. And it's not always what the media reports, but that's the reality on the ground. Care to comment on the nature of some of these protests?
Yes. Well, as we know, Dr. Martin Luther King said in the 60s, when they had riots in Los Angeles and other cities around the country, that riots are the cry of the unheard. That's not an endorsement by him, and what I'm about to say is not an endorsement of looting by me, but it is an analysis and a reality that we have to understand, that when you don't pay attention, people get frustrated, and that frustration can boil over. Now, to those people who deliberately exploit this opportunity, be they right-wing terrorists, which were arrested in Nevada, or whether there are some Antifa folk taking advantage of the situation, they should be prosecuted, as you said. But there's another problem here. The President of the United States wants to take that small percentage of people and tarnish the entire protest movement with their character. But the real truth is this. The riot started on a street in Minneapolis when a police officer put his knee on George Floyd's neck. That was when the riot started, not when the first building was burned or window broken or television stolen. The riot started on a street in Minneapolis.
Thank you, Reverend. Here's a question for Dr. Lacroix from Darla in San Marcos. Darla says, my 92-year-old mother is in a nursing home. They have been vigilant and I have not seen her since March. We Zoomed only once with my siblings. Do you know when California will ease its visiting restrictions?
Well, I want to say hi, Darla. Your question resonates with so many of us, especially me, an old lady epidemiologist, and I mean that in all the ways you can take it. My own mother has dementia and lives in a memory care facility in White Plains, New York, near my sister. Neither of us have been able to see her since mid-March. And this is because of the tragedy of the commons in U.S. residential facilities for older people. The COVID pandemic's first hotspot was in Kirkland, Washington, in a nursing home there. And to this day, The extent of the epidemic in that location, the numbers of people infected, the numbers who died have not been determined and have not been counted in that 109,000 you're talking about. I think they only count one death from that Kirkland nursing home, and we know there were many, many more. In California, an LA Times investigation concluded that about half of all the COVID deaths in California have occurred in nursing homes and assisted living facilities. The staff, and I might mention that the staff in residential care facilities is disproportionately minority, and residents of our aging care centers have had very little access to testing and contact tracing. At the height of the pandemic in New York City, an overtaxed hospital was no place for a frail older person to be. We have completely and devastatingly failed to protect our aging population residing in nursing homes and other residential care facilities, and the staff who are trying to take care of them and keep them alive while all of us wait for the day that we can see them again. So the answer to your question, how long before visits can resume, in most places is still probably months. The CMS Medicare agency is urging nursing homes to continue barring visitors until they have gone at least 28 days without a new COVID case originating on site. And there are several other benchmarks to meet too, including a decline in cases in the surrounding community, which we don't have even in San Diego this week anymore. The ability to provide all residents with a baseline COVID-19 test and all staff with weekly tests, adequate supplies of PPE and cleaning and disinfecting products, and no staff shortages, which were just rampant at the Kirkland nursing home. And it's probably epidemic, the staff shortages at long-term care facilities. So I want to say to Darla, try to schedule more FaceTime visits with your mom regularly. Contact your mother's caretakers and try to visit with her more often. And also, I just wanted to mention that end-of-life visits, although this is a little consolation to those of us waiting to see our loved ones, are also allowed at many facilities. But that's too long to wait. So we really need to do better by the nursing homes. Incredibly important question, and another area in which I think we've been just derelict.
Thank you, Doctor. Reverend Shockley, here's a question from Jeff in Solana Beach. He asks, what role do you see for the church in the pandemic and the demonstrations? What have you seen? What would you like to see? And how can we get from one to the other?
Well, I think the first responsibility of the church is to tell the truth. I know that at Pilgrim on tomorrow at 10 a.m., I will be preaching about this crisis in our country. The title of my sermon is I Can't Breathe. What I want to believe and what I hope is that churches across this country will be raising up the truth that has been clearly displayed on television for everyone to see, that police brutality against people of color is an epidemic. I hope that churches will not turn away because of the political leanings of their congregation, but that pastors will take the full freedom of the pulpit to declare the truth. When I talk about truth, one of the things that frustrates Black folks is that we've not been listened to. We've not been believed when we've said that we've been beaten by the police and brutalized by the police, shot by the police, hurt by the police, killed by the police, until it was on videotape. So effectively, for the 400 years we've been complaining about slave patrols and police brutality, we've been called liars. We've been disbelieved. But now we have it on videotape. The police said that George Floyd resisted arrest. We have it on videotape that he did not resist arrest. The police in Buffalo said that the 75-year-old white man tripped and fell. But they forgot to mention in their official police report that he was pushed by the police to the ground. So we have evidence that the police do lie. And so the burden of proof has now shifted. And I want our churches of every denomination, I want our people of faith of every faith to acknowledge this truth and to come together to end this brutality now. So that's the first thing I want churches to do, is simply tell the truth about what's going on in America. And secondly, as we saw in the 60s, churches poured out into the streets. I was pleased to see clergy joining this protest here in North County, and protests across this country are populated with clergy. So encourage your members to get out in the streets and protest to bring about a change in our society.
Thank you, Reverend. Here's another one for Dr. Lacroix from Adele in Solana Beach. 3 employees at my bond store got letters from their doctor to get relief from wearing masks because of deviated septum. Is this acceptable, especially for a grocery worker?
Interesting question, Adele. So a deviated septum occurs when the thin wall in your nose between your nasal passages is displaced to one side. And when the nasal septum is off center, it can make one nasal passage smaller and more difficult to breathe through and block airflow, therefore making already uncomfortable mask wearing more uncomfortable. So it is possible for physicians to write written exceptions to mask use. The Americans for Disabilities Act requires reasonable modifications of policies, practices, or procedures, such as the face mask rule, when necessary to provide goods and services to individuals with disabilities. However, the ADA does not require a public accommodation to permit an individual to have an accommodation that would pose a direct threat to the health and safety of others. So if I were working in a grocery store and a colleague had been excused from mask wearing by their physician, and they were in a public-facing job in the grocery store, first of all, we wear masks mostly to protect other people. So these employees are being put at risk as well as the general public. The whole purpose of our occupational health structure is so that workers don't have to choose between going to work and basically dying or having health problems. And I think in the case of this person, what would be appropriate is if they can't wear a mask because of a deviated septum, that there be other accommodations made so that they're not public facing and they're not posing a risk to their coworkers. Just saying this person can't wear a mask, but they can go about their work and be unmasked and exposed to hundreds of people a day is not acceptable.
Thank you, Dr. Lacroix. Maria in Encinitas asks, I heard that the pandemic money from EDD has dried up. Is that true? No, Maria, that's not true. You can still apply through the California Employment Development Department, both for unemployment insurance as well as for the expanded 13 weeks that we passed as part of the CARES Act. In addition, those who are 1099 independent contractors or gig economy workers can also qualify for the new pandemic unemployment assistance program that I mentioned earlier. If you have any questions about any of these programs or you need help, feel free to contact our office. We also have on our website at mikelevin.org a resource guide, which includes links that you may need to find all the relevant information. But we'd love to help you or direct you to EDD or to our friends in the State Assembly who handle these cases as well. We work together every single day trying to serve our community. I will say that the EDD website took a while to get up and running. My understanding is that when we expanded the unemployment insurance program to include new eligibility, that it required basically a rebuild from the ground up of their system, and that now has been completed and now is operational. So if you need any help at all, don't hesitate to contact our office. Related question from Dottie in Dana Point. Do you have any update on how long it is taking EDD to process claims for pandemic unemployment? Well, I think in the beginning, as I mentioned, they were having significant problems with technology, and it was taking quite a while to process claims. We definitely spoke up. The California Congressional Delegation spoke up with the California Secretary of Labor. She was committed to fixing those issues as quickly as possible. I think by and large they have been. But if you are continuing to have problems and you're waiting on benefits that aren't being processed, do please contact our office. You can also contact your state assembly member, Tasha Burner Horvath, or your state senator, and we'd be happy to help. Here's a question for Dr. Lacroix from Joan in Oceanside. Has there been any progress on finding a common thread amongst the children who have developed MIS-C following possible COVID? I hope you know what that stands for. In those that never tested for COVID, are they now being antibody tested? Specifically, is anyone looking into a history weeks before of medications used, aspirin, Tylenol, etc., or exposure to toxins, herbicides, pesticides, or previously unrecognized genetic abnormalities?
Well, thanks for that complicated question. You're really putting my feet to the fire today. So far in the COVID pandemic, a small number of children, and I want to emphasize this is a rare condition, have been diagnosed with a severe disease called multisystem inflammatory syndrome in children, MIS-C, associated with COVID-19. It's a condition where different parts of the body can become inflamed and painful, including the heart, lungs, kidney, brain, skin, eyes, or gastrointestinal organs. We don't know what causes this disease yet, but we do know that many of the small number of children who presented with these symptoms had viral infection with COVID, or have been around someone with COVID. They are being tested, and they're heroic stories of these kids trying to stay alive while the diagnostic process kind of has proceeded in one direction or another. The disease has been compared to Kawasaki's disease. It's also been compared to toxic shock syndrome. It can be serious, even deadly, but the children who have been diagnosed so far in the United States have gotten better, usually with medical care, so that's good. Aside from the simple epidemiology that the age range of children affected has ranged from 2 to 21, we really don't yet know any of the common threads or risk factors for this condition, but it is being studied at the CDC and at various other places. So I'm confident that we will learn more about it, just as we'll learn more about lots of other things we don't understand about COVID at the moment. The thing I want to end with, though, is if you think your child is sick with MIS-C, you need to contact your healthcare provider and system right away. The symptoms include fever, abdominal pain, vomiting, diarrhea, neck pain, rash, bloodshot eyes, feeling extra tired, trouble breathing, pain in the chest that does not go away, confusion, inability to wake or stay awake, bluish lips or face, and severe abdominal pain. So that if any of those things are happening with your children, please call your doctor.
Thank you, Dr. Lacroix. Another one for you from Nisa, who is a doctor in Rancho Santa Fe. She says, I've been reading about the correlation of high antibodies for measles to a low death rate from SARS and now COVID-19. And locally, Quest is involved in the study looking at the correlation of MMR antibodies and COVID-19 antibodies. I'm surprised that I haven't heard more about this on the news. If vaccinating with MMR2 could lower COVID-19 risk, it would certainly be a very safe and relatively inexpensive thing to do. Can you comment about this? And she encloses a link with more information. Thank you.
Couldn't use the link, but I went out there. I went out there and found, I think, the two original papers that are suggesting that there's some relationship between MMR antibodies and COVID-19 antibodies. One paper was a published epidemiologic analysis correlating patients who received measles and rubella containing vaccines, such as you get when you take an MMR, and reduced and a reduced COVID-19 death rate. And then similar observations were recently noted in a Cambridge study by Young, who found that like a 23% correlation between the protein homology in the COVID-19 virus and the rubella virus that seems to make the epidemiologic data make more sense. The bottom line from my perspective, looking at these first reports, is that, first of all, we should have MMR vaccination. Kids should be MMR vaccinated. We should have all our vaccinations. And if having that vaccination is protective against severe disease and death from COVID-19 exposure, that's very good. Right now, there are plenty of people with MMR vaccination getting infected with COVID, which rules out, any real protection from infection by that vaccine. I am sure that scientists will benefit from this observation in trying to develop a vaccination specifically for COVID. And in the meantime, if you haven't been vaccinated for MMR, get the vaccine.
Thank you, Doctor. Janice in Vista says, I work for a school district and we just received word that our budget is going to be cut for next year by a significant amount. How are schools supposed to implement social distancing with less money? We actually will need more to make it possible to have more classroom hours so students can have limited numbers on campus and in classrooms at any given time. Well, Janice, first of all, thank you for your great work for our students. I am so grateful for all of our teachers. My own two kids just graduated from second grade and kindergarten, or at least virtually graduated from second grade and kindergarten, and had an opportunity to thank my daughter's kindergarten teacher the other day for their adaptability to distance teaching. And there absolutely are concerns around funding and around what the new school year will look like, trying to adhere to the best guidelines that our public health experts are providing. I have advocated straight through for additional funding for our schools. I've spoken now with, I believe, every superintendent in our district, up and down our district, and they all agree that they're facing significant financial burdens due to COVID-19. Our state, as I'm sure you know, went from a $21 billion surplus to a $54 billion deficit, seemingly overnight because of this pandemic. And we know that we will need additional funding for our state and local government in order to try to keep things solvent and to keep moving forward in a positive direction. The bill that I mentioned before, the CARES Act, contained $31 billion for our schools, both through K through 12 and higher ed. The schools in our district received some funding, but not enough, particularly because a lot of the money was tied to Title I eligibility. In addition, the higher education institutions in our district also have been very hard hit, and they received, I think, around $45 million in total under the CARES Act between UCSD and Miracosta College and Saddleback College, but they too need additional help. So we've advocated in the HEROES Act for help for education in two different ways. First is more state and local government funding. As I mentioned before, over $875 billion, of which $300 million would go to the cities of the 49th district directly. In the CARES Act, there was a limit on direct funding for cities that if you had a city under 500,000, you didn't receive any direct funding. That didn't seem fair, and I led a effort along with each of our mayors, Republican and Democrat alike, as I mentioned, to House leadership, and many of my other colleagues did the same, and we were able to get that in the HEROES Act. Why is that so important? Well, the example that I like to use, and I'm not picking on my friends in the city of Fresno. Fresno has 530,000 people and received about over $90 million in the CARES Act. Long Beach has 480,000 people and received nothing. Mm-hmm. So I don't particularly think that's fair, and neither do my friends in Long Beach. So in order to try to rectify that, we did in the HEROES Act. Also, in addition to that money, a lot of which would go to our schools, there's another $100 billion specifically set aside for education in the HEROES Act. Now, all of this, as you probably know, sit on Mitch McConnell's desk, along with a lot of other things that we've sent him. And Mitch McConnell now, first he said, let state and local government go bankrupt. That means not enough money for our schools in addition to everything else. But then he said, let's just take a pause. And again, what I would say is the pandemic has not taken a pause. The crisis that our schools will face as they attempt to reopen with social distancing and other measures and less money, that certainly hasn't taken a pause. The Senate should not be taking a pause either. So we're going to continue to press for action in the Senate. And I thank you, Janice, for teaching our children. Here's a question for Dr. Lacroix. This is from Joyce in Oceanside. Joyce asks, does home isolation actually work? When one person in the home begins to show symptoms or is sick, can you really protect yourself by isolating, or is it just too late by the time they show symptoms? It is very difficult logistically to undertake home isolation, not to mention the mental stress of locking oneself in a single room for 2 weeks or even a few days.
Boy, isn't that the truth? Thanks, Joyce, for this question. I too have wondered whether husband and I would be able to self-isolate if we got sick and keep the other one from getting sick while we're preparing the food and washing the sheets and clothes of our sick spouse. But the short answer to this question is that it is definitely yes. Home isolation does work to reduce the risk of infection in family members. Transmission within families is common, though, because of the pre-symptomatic phase of the infection and the fact that the risk of transmission can't be completely eliminated. But let me tell you the results of a study from China that shed light on this. So they looked at 392 household contacts of people with SARS-CoV-2, and amongst those, 64 developed a secondary infection from the index person. The secondary attack rate to children was only 4% compared to 17% for adults. This is the most exciting finding of the day. The secondary attack rate to the contacts within the households with index patients who quarantined by themselves since the onset of symptoms was 0. 0 got infected compared to 17% for contacts without quarantined index patients. That's a pretty extreme finding, but it's one that gives me a lot of confidence that the quarantining in your home can help. What's hard is being a spouse. The secondary attack rate to contacts who were spouses of index cases was 28% compared with 17% for other adult members in the household. So the jury's still out on whether spouses can keep from infecting each other, but it's definitely helpful to quarantine.
Thank you for that, Doctor. Here's another question for you from Matt in Del Mar. With high rates of asymptomatic transmission, how frequently should people be tested, and how often do you get tested?
See, where the rubber meets the road is like, what are you going to do about problems in our country, which is so true. Great question, Matt. One that's being asked across the country to inform reopening strategies, especially for workplaces and schools. So I just wanted to say that my framework for answering this question is the Return to Learn program at UCSD. And if you Google Return to Learn at UCSD, up will come a website talking about the principles of that program. Our infectious disease modelers on campus have estimated that testing the on-campus population once a month in combination with contact tracing and isolation of infected people would give us a 90% chance of keeping the spread of disease under control. So what does that mean, spread of disease under control? That means that the virus is not increasing in prevalence in the on-campus people coming to campus to study and to work. However, that plan assumes that 70% of people would participate in testing once a month. So again, the whole pandemic trajectory is really dependent on our behavior and what we decide to do. Testing in higher risk environments like the nursing homes may need to be done more often. In the state of California mitigation plan recommendations for skilled nursing facilities, they recommend when there's no infection at all in the nursing home. So everybody's been tested, all the staff, all the residents, and they have 0 infections. They recommend surveillance testing of 25% of residents and staff every 7 days to ensure that 100% are tested once a month. So once a month seems to be our working understanding of how often we need to be tested. Since I'm still quarantining with my dear sweet husband, I have not yet been tested. But I am committed to getting tested monthly when I return to campus. And there's just two caveats I want to mention in relation to this plan. One is that the PCR tests for active infection are not perfect. And there are other questions today that get at the imperfection rate, but it's not nothing. And second, that the testing does not prevent us from getting infected. If we're positive, we're already infected, but it mitigates spread to others if we are infected. It's all about early discovery and preventing the spread to other people. So my approach right now is to try and minimize my circulation in the community until there's an effective vaccine and effective and available treatments for COVID-19. But getting back to Reverend Shockley's opening statement, I get to do that. Not everybody gets to do that. It's a privilege to get to do that. I still think that it's the responsible thing for me to do so that I don't get infected and spread it around. I do this not because I love staying home with my husband all the time, but because I want to be around for the next 30 years. And that's my answer, to this question. Once a month, I haven't yet been tested, but I will be tested so that I don't put other people at risk, and I'll do it once a month.
Thank you, Doctor. Appreciate that. Here's a question from Sandy in our district. Sandy says, there was recently a KPBS article about potential voter suppression due to naturalization ceremonies being on hold due to COVID-19 shutdowns. Well, it appears that the naturalization process is still happening here in San Diego. That's not the case at the national level, and there's no one in San Diego who's registering these newly naturalized citizens to vote. They are a voting bloc that needs to be heard. Is there anything you can do to help? Well, look, the way I see it, if somebody has done everything they need to do in order to become a U.S. citizen, and the only thing holding them back is a naturalization ceremony. And we know that there have been virtual naturalization ceremonies that have been conducted successfully, and that we now have the technological capability to do what we're doing right this instant, which is to use virtual technology for everything from meetings to classrooms. But then we ought to be doing that to the extent we need to for naturalization ceremonies as well. And what I will do, Sandy, is I will go back. I'm a proud member of the Congressional Hispanic Caucus. I will go back and speak with them about this issue. In fact, I won't wait to go back. I will reach out and ask what we can do. Again, I think everybody that has gone through the process and is otherwise eligible to vote, save for a naturalization ceremony, ought to be able to vote this November. Here's a question for Dr. Lacroix from Bonnie in Vista. Bonnie says, thank you so much for all that you're doing. If my husband and I are out walking in our neighborhood and runners run by huffing and puffing without a mask, less than 12 feet away, and sometimes less than 6 feet away, if it's windy and blows our way, are we at risk of catching COVID-19?
Someday they'll have a little app you can use for that. So great question, Bonnie, and one that a lot of people are wondering about. In general, walking and running outside are some of the safest activities we can do right now, assuming that we all follow the actual social distancing guidelines. One thing to keep in mind is, generally speaking, germs dissipate very quickly outdoors, but that doesn't mean you can give up distancing and other COVID-19 prevention measures. It's wise to maintain a longer distance when you're walking and running outside, and some people are saying 12 to 20 feet is better, is a better distance than 6 feet. If you see a runner approaching you, give them wide berth to pass you. Given the importance of social distancing when doing intense forms of physical activity like walking really fast or running, many recommend choosing times of the day and locations when you are less likely to encounter other people, like early in the morning or like places in your neighborhood where you don't generally run into people. If you find, though, that you pass someone huffing and puffing within your 6 foot zone of safety, and when you weren't wearing a mask, the odds are still good that you will not be infected. So I want to make you feel better about that, but just know that there's no guarantee of zero risk when we are out and about.
Thank you, Doctor. And we have about 10 minutes left. What I'll do is I will get through the medical questions that have been asked, so we make sure that we get to those, and I'll give each of you an opportunity to close. The next medical question is from Sarah. No, check that, from Susan in San Diego. How reliable are the PCR and antibody tests currently in use? Could you please explain the differences between the tests as well as the limitations? I know this has been discussed before, but I think it might be useful to repeat this info. Thank you for all these informative sessions.
So I'm not going to repeat the class that Dr. Garfien has taught you several times on the difference, the differences between the viral and antibody tests, at least completely. I just want to give you a summary, and that is that the viral tests are the PCR tests, and they're thought to be the most accurate. But what I was able to find to tell you about today was a new pooled analysis of 7 studies evaluating the accuracy of the PCR viral tests. And this, I think, is also amazing information. So over the 4 days of infection, this is a pooled analysis of 7 studies, over the 4 days of infection before the typical time of symptom onset. So you get infected with the virus and you don't know you have it. 20 to 30% of people never know they have it. The probability, if you take a viral test with the PCR technology, the probability of a false negative result in an infected person decreases from 100% on day 1, 100% wrong. It's going to say that you're negative, but you're already infected, to 67% on day 4. On the day of symptom onset, the median false negative rate is 38%, and it decreased to 20% on day 8 of the infection, and then began to increase again from 21% on day 9 to 66% on day 21. So you have this viral load, and the test is able to pick it up most accurately during a window starting from day 5 of your infection to about, during the symptomatic phase from day 5 to about day 8. And after that, it gets worse again. So these tests are not perfect. The other test is the antibody or serology test, which tells you if you've had a previous infection. And Dr. Garfien has told you about the difference between the IgM and the IgG antibody tests. Also a fascinating situation going on in our country. When last I spoke with you all, there were 12 antibody tests that had passed the FDA's emergency authorization process. Today, there's 16 antibody tests that have passed this, while the agency works with the NIH and the CDC to independently validate serology tests. This is in the context of over 200 antibody tests that are currently under a pre-emergency use authorization or the EUA review itself. 200 antibody tests. When you get an antibody test, you wonder which of those tests you got. Did you get one of the 16? Did you get one of the 200 that hasn't been validated at all? I have a link that the congressman can post to the FDA website that summarizes the performance of these tests. Several have positive predictive values in the 50% range. What is a positive predictive value? This means that about half of the people who have a positive antibody test actually have the antibody present, and the other half who have a positive antibody test do not. So not so good in terms of if you were using antibody testing, for example, to say to people, yeah, it's okay for you to go to work and you don't have to worry about anything because you've had the virus already and you're probably immune. And that leads me to just end with saying that an antibody test may not be able to show if you have a current infection because it can take 1 to 3 weeks after infection to make antibodies. And we don't yet know if having antibodies to the virus really will protect you from getting infected with the virus again. And if it does, how long that protection might last.
Thank you very much, Doctor. Another one from Sarah in Dana Point. who says, I have read a couple articles lately that claim COVID-19 is a blood vessel disease, inflammation of blood vessel lining, and that statins, ACE inhibitors, or anticoagulants could help. Any validity to any of this?
Well, thanks, Sarah. That is a very interesting question. And yes, I do think there's some validity to what you have read. This hypothesis comes from a recent letter. It looks like this. This is the letter in the Lancet by doctors at the University of Zurich and also Brigham and Women's Hospital. And they wondered what could explain the severe forms of COVID infection being seen among people with underlying cardiovascular disease and diabetes. So what they do in this letter is they tell the stories of 3 patients with COVID who have these underlying diseases, which showed that the virus infected their endothelial cells, and these are the cells that line our blood vessels, and they caused endothelial inflammation. And there's a word for that I'm not going to try to pronounce. Then they posed the hypothesis that the infection and inflammation of the endothelial cells could explain the blood clots, heart attacks, and strokes being seen in some severe cases of COVID, and that the anti-cytokine drugs, ACE inhibitors, and statins could be useful. So this is a case series type study and a hypothesis. It does seem likely that the eventual treatment cocktails for COVID will include both antiviral medicines and also anti-inflammatory medicines. And I've been told this by emergency medicine doctors who are colleagues and friends. Many are under investigation now in clinical trials. So yes, I think that's a valid hypothesis, but yet to be proven.
That's really interesting, and that's encouraging. Couple quick ones. Sharon from Facebook asks, is it true that men get the virus more than women?
Lovely question. It is not true that men get the virus more than women. I wanted to tell you the statistics from Orange and San Diego County on that. The infection rate in San Diego County is 50% male. The deaths are 56% male. In Orange County, the infectious cases are 51% male, and the deaths are 56% male. The death rates in other places are up to twice as high in men. And so what is the cause of this incredible sex differential in COVID-19 mortality? So Robin Klein at the University of Washington in St. Louis says, with regard to viral infection, it's been very well established that women have much stronger immune responses than males, not just as a result of exposures or behavior, but there are actual differences in the ways that immune cells respond. Some speculate that this is because we have 2 X's and you guys only have 1 X and the other one's a Y, okay, in the sex chromosomes. We have a lot more to learn about why exactly this is, but generally women's immune cells respond faster and more powerfully to viral attacks, producing higher amounts of interferons, proteins that stop viruses from replicating, as well as antibodies that neutralize the invaders. So I do regard my own behavior very much so. I mean, like, I don't really care if I get COVID, but I do not want the husband to get COVID for exactly the reason of this person who asked, and you said it was. I'm
not sure if my wife would agree that she would agree to that. I mean, that same statement.
It's like I just wouldn't be able to forgive myself if I were the reason that husband got COVID infection. So it's a strong motivation for me.
Well, I think we're going to have to end it there.
Okay.
Just from the perspective of time, but I want to give both of you an opportunity just to close, and Reverend Shockley, I want to get to you in just a second and make sure that we also give our audience an opportunity to know how we can tune in tomorrow to see the services at Pilgrim UCC. But Dr. Lacroix, any closing thoughts or comments about where we are with this virus?
Well, I'm going to close. I had lots of great work to do this week with my colleagues across the country, and I'd actually just like to close with the closing statement of Michael Lamont. He's an epidemiologist at the University of Buffalo. Buffalo had a tough week this week as well. And he said to us at the end of our call, hate got us into this, and it's going to be love that gets us out. And that's how we close.
Thank you so much, Doctor. Reverend, you've been an inspiration to us this week and during this 90 minutes. I'm incredibly grateful to you for all of your leadership for many years, but particularly in this time of difficulty for our community. Thank you for joining us today, and would love to hear your closing thoughts.
Congressmember Levin, thank you for inviting me. I know that these are challenging times. I just want to say I really do have faith. I'm a card-carrying optimist. I do have faith and believe that this moment will be different than the moment that we failed in the centuries prior. It's clear that there's a different mood, a different attitude, and a different feeling in the country, where we're coming together in our diverse array of perspectives and races and ethnicities, and every stripe of American is coming together to say we want equality, equal opportunity, and equal justice for every American. And you can hear us on Facebook Live tomorrow at pilgrimucc.california. At pilgrimucc.california.
And what's the website?
pilgrimucc.org.
All right. Hope everybody got that. pilgrimucc.org. Well, I'm going to tune in.
I appreciate that.
See what you have to say tomorrow. I'm truly grateful, and to both of you for joining us, for sharing your wisdom, your experience. I hope that those of you watching found this informative, and that you'll tune in again next week. And once again, as I've said, week in and week out, I think we've done these now for close to 20 times. Please follow the recommendations and the public health guidance of the CDC, the state of California, and our counties. It's everyone's intent that we get things back to a new normal as quickly as we can in the wake of COVID-19. But the sooner that we follow those health recommendations, the better that we follow those health recommendations, the better we'll be able to get back to that new normal. And finally, once again, I just want to express the importance of confronting the racial inequality and systematic injustice in our society today. And as I said in my open, and as I said yesterday at the rally in Cardiff, the only way I see us getting through it is if we start listening to one another, start helping each other, start advocating for one another. And then we all need to speak up the loudest for those who need the most help. That's how we're going to bring about the real change that we need. Thank you all so much for watching. We'll see you again next week.